Breast cancer stage 3 overview. Hearing you or a loved one has stage 3 breast cancer can lead to many questions about diagnosis, survival, treatments, and more. The first thing to know in that stage 3 breast cancer means the cancer has spread beyond the tumor. It has possibly gone to lymph nodes and muscles but hasn't spread to nearby organs. Doctors have previously divided stage 3 into more specific categories: stage 3 3A, 3B, and 3C, and the cancer subtype, meaning which type of breast cancer you have. The best breast cancer type describe how a cancer grows and what treatments are likely to be most effective. Stage 3A breast cancer means one of the following description apply: either T0N2MO, there is no actual tumor, is associated with the cancer cells, or the tumor may be any size, and the nearby lymph nodes, 4 or more lymph nodes with as many as 9 affected, contain cancer. T0 no actual tumor or no tumor, MO no metastasis. Stage 3A, T3N1MO, or the tumor is larger than approximate size of a small lime, more than 5 centimeters, and small cluster of breast cancer cells are found in the lymph nodes between the approximate size of a pinprick and the width of a grain of rice, 0.2 mm to 2.0 mm. So T3 more than 5 cm, N1 no metastasis, MO no metastasis. In stage 3A, T3 N2MO, the tumor is larger than the approximate size of a small lime or over 5 centimeters, and the cancer has spread to 1, 2, or 3 lymph nodes under the arm or the breastbone. Stage 3A, tumor is less than 2 cm with cancer has spread to 49 lymph nodes, or tumor larger than 5 cm, cancer cluster found in the lymph nodes, tumor larger than 5 cm, plus cancer has spread to lymph nodes near the breastbone or sternum or underarm. So the stage 3 ATNM classification: T0 N2MO, T1 N2MO, T2 N2MO, T3 N2MO. So the marking is the node 2, N2. So if T1 tumor less than or equal to 20 mm or 2 cm, T2 tumor more than 2 cm to less than or equal to 5 cm or 2 to 5 cm, T3 tumor more than or equal to 5 cm in greatest dimension, N2 meaning 4 to 9 axillary lymph nodes metastasis or positive ipsilateral internal mammary lymph node metastasis by imaging in the absence of axillary lymph node metastasis, MO no metastasis. Stage 3B cancer means the following description apply: the tumor may be any size, and cancer has invaded the chest wall or breast skin with evidence of swelling, inflammation, or ulcers, such as with a case like inflammatory breast cancer. The breast cancer may also invade up to 9 nearby lymph nodes. So stage 3B, tumor can be any size, cancer has spread to the chest wall or breast skin, plus cancer has spread to the lymph nodes. So stage 3B, either T4 NOMO, T4 N1 MO, T4 and 2MO. So if you say T4, tumor of any size with direct extension to the chest wall or skin, any size, and 1, meaning micrometastasis, or metastasis to 1 to 3 axillary lymph node. Macrometastasis by sentinel nodes, biopsy, negative, clinically internal mammary lymph node. And 1 to 3 axillary lymph node. And 2, metastasis to 4 to 9 axillary lymph node, positive internal mammary lymph node by imaging in the absence of axillary lymph node metastasis. So T4 any size, N1, 1 to 3 axillary, N2, 4 to 9 axillary lymph node. If the sentinel biopsy is positive with involvement of 1 to 3 axillary lymph node, N2, positive internal lymph nodes by imaging without axillary lymph node is considered also N2. The stage 3C breast cancer means one of the following description applies. Either no actual tumor is found in the breast, or the tumor may be of any size. So such as cases with inflammatory breast cancer, there is no actual tumor in the breast. And cancer may have invaded the chest wall or breast skin with evidence of swelling, inflammation, or ulcers. And cancer has also invaded 10 or more lymph nodes under the arm. If 10 to more lymph nodes, stage 3C. Stage 3C, no actual tumor is found in the breast, or any tumor may be any size, and lymph node extending the collarbone area are found to contain cancer. So if it is in the infraclavicular, it's considered stage 3C. Stage 3C also may be no actual tumor is found in the breast, and the tumor may be any size, and lymph nodes under the arm or near the breastbone are found to contain cancer. So there are also cancer lymph nodes in the internal mammary lymph node area or in the arm. So stage 3C may be 3 types: 3 no tumor or a tumor of any size, plus cancer has spread to 10 or more lymph nodes. If 10 or more lymph nodes, stage 3C. Or another category, no tumor or tumor of any size, plus cancer has spread to lymph nodes near the collarbone or the infraclavicular area. Another category, no tumor or tumor any size, cancer has spread to lymph nodes near the underarm or the breastbone or internal mammary lymph nodes. So stage 3C breast cancer is divided into operable and inoperable stage 3C breast cancer. However, the term inoperable is not the same as untreatable. So stage 3C, any T, the N3MO. N3 means metastasis in 10 or more axillary lymph nodes or infraclavicular node or internal mammary lymph node plus level 1, level 2 lymph node or the supraclavicular lymph node. So T3, N3 has 4 categories: that 10 or more, infra, internal, and supraclavicular lymph node. Those are the markers. If your physician uses the word inoperable, it may simply means that a simple surgery at this time would not be enough to get rid of all the breast cancer that is within the breast and the tissue around the breast. There must be healthy tissue at all of the margins of the breast when it is removed. Keep in mind that the breast tissue goes beyond the breast mount. It goes up to the clavicle and down to a few inches below the breast mount. There must be a tissue to close the chest wound after the surgery is performed. Another treatment method may be used to first shrink the breast cancer as much as possible before surgery is considered. What should a person with stage 3 breast cancer expect from treatment? Stage 3 treatment options vary widely and may consist of mastectomy and radiation for local treatment and hormone therapy or chemotherapy for systemic treatment. Nearly every person with stage 3 diagnosis will do best with a combination of two or more treatments. Chemotherapy is always given first with the goal to shrink the breast cancer to be smaller within the breast and within the lymph nodes that are affected. This is known as neoadjuvant chemotherapy. Other possible treatments include biologic targeted therapy and immunotherapy. There may be various clinical trial options for interested patients with stage 3 breast cancer. What are the survival rates for stage 3 breast cancer by stage? Survival rates can be confusing. Remember that they don't reflect your individual circumstances. The relative survival rate for stage 3 breast cancer is 86%, according to the American Cancer Society. This means that out of 100 with stage 3 breast cancer, 86 will survive for 5 years. But this figure doesn't consider breast cancer characteristics like grade or subtype. It also doesn't distinguish between people with stage 3A, stage 3B, and 3C. In comparison, the relative 5-year relative survival rate for stage 0 breast cancer is 100%. For stage 1 and stage 2, it's 99%. For stage 4, the survival rate drops to 27%. So the stage 3 breast cancer, the survival rate is somewhere around 80. Please subscribe to my channel and click the notification bell to hear more updates. The greatest healing, the therapy, is friendship and love. Thank you.